Good evening, everyone. On behalf of American Society of Civil Engineer, ASC and ITK Student Chapter, I welcome you all to this webinar as part of the Civil
Tell Kate,
Summit
she's talking,
Nirma
she's talking.
2021. Today, we are honored to have with us Dr. Shweta Arora from Doctors Field. Dr. Shweta Arora is a medical doctor and a trained public health specialist with 6 years of experience in public health. She has worked in areas of primary care, epidemiology, biostatistics, health research, health system strengthening, public policy
Going live.
drafting,
Okay.
monitoring, and evaluation of health
Here also it's
programs,
going live. I'm muted,
capacity
right?
building of healthcare workers,
Cool, cool.
teaching and training of undergraduate and
Mute.
postgraduate and
And
medical
also my
interns.
OBS is also working.
Dr. Arora is also a recipient of various awards like Proficiency for Surgery, Best Postgraduate Student, Best Original Article for Lung India Journal, and Best Paper Award in international conferences. She is the author of 4 publications and presented her research work findings
Okay.
in
People
nearly
18 are
10
watching now. Let's
national
end
and
it by join
international
in another 10 minutes
conferences.
maybe max.
In these trying times,
Cool.
we can say that the education sector has been affected the most. It's not going the way it should, and there have been a lot of obstacles in the
You can
field
set
of
up a
learning.
reminder in ASC also
In case
in
of
terms
any
of
subject,
broadcast.
any stream, or any university, students are required to do some sort of
Sure, sure.
practical training or
Okay.
internships.
Yeah, cool.
But now it's very difficult to do so.
Thank you, bro.
Thus, let's turn to the
Yeah.
experts, the
Bye.
doctors, to help us in these times. Presenting to you
Sure,
Dr.
sure. I'll do
Shweta
that.
Arora. Respected ma'am,
Yeah, cool.
greetings
Yeah.
and welcome to this online webinar session with AC and ITK Student Chapter. We are honored to have you with us. There are quite a few questions and doubts we'd like to know answers to. Please guide us how we can ensure that we are answering all your questions accurately and effectively.
Thank you, American Society of Civil Engineers Students Club. I am really delighted that you've invited me on this online platform. And I believe these days we are all meeting online only, and that is the way we are surviving each other. Otherwise, COVID has led to the disaster which we have never thought of, as in it was in 1918 that the world saw a last pandemic when Spanish flu occurred. Now the history has repeated again, but we never knew that we will be the ones who will be witnessing this pandemic all alone. So yeah, COVID-19, I need not to go into so many nitty-gritties, what kind of virus it is. You guys know more than this. Infodemic has been there, not just the pandemic, the infodemic of the information circulated through WhatsApp groups, through various social media platforms. So I won't go much into that, but I will be focusing more on how we can prevent it and how we can deal it while we are sitting at homes or in our workplaces. Yes, can I have the slide first? So COVID-19, as I mentioned, is just a virus which had recently been discovered in 2020, 2019, when it first occurred in Wuhan, China, and then followed by it has affected the whole world, which present with most common symptoms as in like the fever. You may feel tiredness, dry cough, aches and the pain in the body, nasal congestion, running nose, sore throat, diarrhea. There are multiple symptoms. At times, even the conjunctivitis, a simple conjunctivitis, can present as COVID-19. So one cannot even say that, okay, who only develops fever will have COVID. There are, many cases. In fact, 80% of the people may be asymptomatic who won't even present with the symptoms. And this COVID-19 has actually, in India, it has been shocking, specifically the second wave, and still since the starting, it has already caused 18 million cases and 0.2 million deaths still now. Next, please. Now, there are 15 promises which we should learn as the COVID appropriate behavior for all of us that we must follow all in all times. First and foremost, greet without the physical contact. We should learn from our ancestors why to go for hello, say namaste. It's easier. Even now, the people in other worlds, Western world is following us. Why not then we should repeat the history? Why should go for hellos and all that? So say namaste. It's much more easier. Then maintain the physical distance. We've been hearing a lot times, do gaj ki duri, 6 feet of distance between two people. Now wear the reusable handmade face cover or the mask all the times. Now in this case, there are a lot of things which have been talked about regarding the mask, which mask one should wear, when should you wash. So I will be discussing this in more detail, just to have an idea about this. And while you're wearing mask, always remember once you're out, avoid touching eyes, nose, and your mouth. One should always do that because we have a habit whenever we are putting a foreign body like a mask on our face. The first habit is to touch it, to touch your face. So don't do that. You're trying to, in a way, transmit the infection towards your nose and the mouth through the nasopharyngeal roots. Always maintain the respiratory hygiene. How one do that? You must be carrying any handkerchief when you're out. If you're not having that, use an elbow to cover your face while you're coughing or sneezing. And following that, wash your surface, like hands or the elbows should be washed off so that you're not carrying the virus with you while you're traveling ahead. Then wash your hands frequently and thoroughly. Now, this step is the most important. This I'll be discussing more detail ahead because this is the one which prevents the infection. And it's not just here, everywhere in the world, it has to be followed. Like even the surgical prevention of the hand washing techniques, it has to be followed. Then there is regularly cleaning and disinfecting the frequently touched surfaces. The surfaces could be the tables, the chair handles, even your laptops when you're using them. So frequently clean them, but I would not suggest that you use something like water to clean your phones. I know I've already damaged two of my phones, so don't do that, please. But you have to look out for other available resources, like there are available for the electronic devices to clean that. Then do not spit in open. You're trying to give the infection to other people who are there. Then avoid unnecessary travel. Now, by unnecessary travel does not only mean going out of, the town. It could be even stepping outside your home when you don't actually require to. You don't need to go out just to have fun, just to go on a ride, just don't do that because currently there have been evidences that the virus is airborne. Earlier we were just thinking, okay, no, we can do that, but the airborne thing has created the much disaster. Then there is do not discriminate against anyone. For this, I would say that most of us as humans have a habit to looking at the one who are infected. Oh my God, stay away. But yes, you need to stay away for your uh, uh, safety. But at the end of the day, don't discriminate in the sense that you need to help them out in such situations. Either you can provide them food, or at times, we have seen tenants discriminating with the people who are staying there who are COVID infected, just asking them to leave their place. That is not correct. They're all humans and we're all going through this pandemic all together. So we need to be empathetic to each other. Then don't go for the crowds. This is most important. Specifically as college students, we have a habit of, crowding up, having fun. I know those are the days that we have seen, and they are the best days in our lives. But these days, the best days are online days. That is how we need to survive on. For a few years at least, we have to think of these things. Do not circulate the social media posts which carry unverified or negative information. So as I mentioned, it's an infodemic more than just a pandemic. There are a lot of WhatsApp groups, there are Facebook groups, the social media has gone to another level to taking this pandemic where a lot of information, not just related to the preventive behaviors, related to the treatment. At times, I being a doctor, people come to me, oh, this is the drug, you must take this. And I'm like, oh God, I am a doctor, please. The WhatsApp messages does not make any sense to me. Why are you telling me this thing? No, they will say, okay, the drug has better effect. Oh my God. So the WhatsApp has actually created the bigger havoc than the pandemic itself has created. Then seek the information on the COVID-19 from the credible sources. When we talk of credible sources, the credible sources are like the Ministry of Health and Family Welfare. There can be WHO, World Health Organization. Then there is Center of Disease Control, CDC Atlanta. These are the places who actually put on with the verified information on research. So yes, that can be helpful. You may call on to certain toll-free helpline numbers, but I don't know whether in such situation when the second wave has set in, how much they are useful. I'm quite doubtful about that. Then seek the psychosocial support for any stress or anxiety. Don't stay, if you are isolated, if you are going through certain, sitting all alone at home, please don't do that. Mental health is also important as physical health. So or keep all these things in mind. And the most important thing, get vaccinated. That is the most important thing. Now, can we move ahead? So as I mentioned, I would like to tell you which kind of mask you guys should be using. So there have been evidences by CDC Atlanta who says that the mask, if you wear it like normal surgical 3-ply mask, which you're using, if you use it normally, the chance of having an infection, it's like 51 to 56%, depending upon it's a cloth mask or the 3-ply mask. But then if you tie a knot for that mask, the chances of preventing the infection, it's preventing the infection, it goes up to 77%. While if you use 2 masks, that is a double mask, if it prevents the infection nearly 85%. Next, please. And then how do you pair it up? We need not to pair it up with 2 surgical masks or 2 cloth masks, no, or 2 N95 and any other mask. Idea is, first you wear a surgical mask. Over that, another cloth mask should be worn. So that is how the pairing should be done. And these days, in the second wave, it is preferred that one should use 2 masks rather than the single 1 mask. Please go ahead. And for mask, now how do you should wear it? We've seen people on the road wearing the mask just because government has told it. Government is fining you. Yeah, because most of us feel like, oh, we'll be fined. No, that's just not the reason. You're protecting yourself. Otherwise, remember, if you don't wear it, the high chances you will get the infection, and God save you, then we don't have oxygen left. Oh God. So it is for our safety, always remember. So one should wear the mask. So you know how one can wear. There are different, but first of all, wear the mask so that the nasal clip is over the nose and the external pleats should face downwards. Then open the mask pleat so that it covers the mouth and the nose as is shown in the figure. Then first, if it is like the mask which we have to tie the strings, first of all, tie the upper strings, then tie the lower ones. And there should not be any gap between the face and the mask. Do not touch the front of the mask. In that way, you will be transferring infection to your face. Then remove the mask first by untying the lower string, followed by the upper string. Then replace the mask after 8 hours or when it is damp or humid. So many a times, you must be using the mask which is like damp, going for a walk or something like for a run. And then following that, the mask becomes damp because of the sweat or anything. Don't reuse it. The mask is of no use after that once it is damp. And dispose of the mask in the recommended manner, which is like putting it in the hypochlorite solution, because that infected particles may remain and these are exposed to the other people who are there in the environment. No need to throw them on the road. Please don't do that. You are in a way giving infection to other people who are on the road. So don't do that. So ideally one should dip it in the hypochlorite solution. And if one is using the cloth mask, every day it should be cleaned, washed off. Then only one should use it, sun dried, and then one can use it. Then clean the hands after you remove the mask, because there may be certain infected particles on your hand, and then you should clean it. And do not reuse a single-use mask, which many of us have a tendency to do that. Next, please. Now, now going on from prevention to the home isolation, I have kept this thing because, 80% of the cases these days are mild cases in case of COVID. So in any case, if God forbid, if there is an infection within the family, then how should one isolate? These are the measures which we should follow. that a person is said to be mild or asymptomatic. Either the person does not have, if asymptomatic, the person won't be having any symptoms, as I told before, or in case of the mild cases, the only the symptoms like the upper respiratory tract infection, like the running nose or some sore throat kind of things will be there, but no shortness of the breath will be there. And the oxygen level, as we say, which we can measure with the pulse oximeter, they don't fall below 94. So in those cases, one can stay at home. But who all can stay at home? There should have such cases. They should have a requisite facility at their residence for the self isolation. Special room should be there, which is attached with an attached bathroom should be there. So where places where you don't have such things, maybe I won't say that. I mean the hostels where the dormitories are there, where people are sharing the toilets. One should not stay there if somebody is infected. And then the caregiver should be available if somebody is staying for the isolation. The caregiver should be there 24/7 to have a communication for that person in case the person may feel may have some symptoms, or may deteriorate their health. So there should be someone to communicate with that person, and in any case they should identify that where to take this person once such a symptoms develop. And elderly people aged more than 60 years or with certain comorbid conditions like hypertension, that means high BP, diabetes or heart disease, chronic lung, liver disease, or any cerebrovascular disease like stroke, they shall only be allowed after the proper evaluation has been done by any medical officer. And the persons who are particularly having any immunocompromised status like HIV or transplant recipients or cancer therapy, they are not recommended for home isolation because they tend to have the more complications for the disease. Next, please. So what do you do? How do you instruct the person who is staying at home? So idea is that the person should stay inside that room, which is very well ventilated, and cross ventilation should be there, and fresh air can just pass on. And all the time that person should wear a mask, a 3-ply mask, and discard, as I told, discard the mask if it is 8 hours or more. And after that, in any case, when the other person is trying to move inside, that person who is staying inside should wear an N95, and the other person who is actually caregiving should also be using the N95. And then, as I told, you can discard the mask by disinfecting with 1% sodium hypochlorite solution. Next, please. So the person all the time who is isolated must take rest, drink a lot of fluids, maintain adequate hydration. We always remember all kind of viral infections. They need a lot of hydration to remove the toxins from your body. Do not share the personal items with this person. Don't ask him to talk into the phone. Somebody else has ring upon him. How are you? Don't do that. Follow the respiratory etiquettes as we talked about. Frequent hand washing with the soap and water for at least 40 seconds, or clean with the alcohol-based sanitizer, and ensure cleaning of the surfaces with the 1% sodium hypochlorite solution. Next, please. Now, hand hygiene, as I told earlier, how can we maintain? Hand hygiene must be ensured following the contact with any ill person or his immediate environment. Also, normally when you're stepping out or you're doing any activity, the hand hygiene should be maintained. And also before you prepare the food, after the food, before eating, after using the toilets, and whenever your hands look dirty. So hand washing with soap and water should be done for at least 40 seconds. Or if you don't have the water available, then the alcohol-based hand rubs can be used if the hands are not visibly soiled. For this particularly, I want to mention, because most of you are, as I have come to know, are civil engineers going into the construction sites, and the dust and the dirt can be there. So for them, alcohol-based hand rub is of no use. So idea is, if you don't have soap or water, soap is not there, but you can just wash your hands with water, and then followed by, you can just use it, alcohol-based hand rub. After using the soap and water, use the disposable paper towels to dry the hands if desirable, and then perform the hand hygiene before and after removing gloves in case when you're serving a person who is being isolated. Next, please. Now, these are the basic steps which have been shown how to do the hand washing. So we always say that for, the 𝗬𝗳𝗏, ulta. So there are certain techniques which have been shown in the figure, like where you put your palms together, like 𝗬𝗏𝗏, then ulta, putting like that. Then muthi, this is the easiest to learn. And then angutha, and then kalai. So these are the easiest steps which one can follow to do the hand washing, wherein all the germs can be removed from your hand. Next, please. Then avoid for this patient, avoid direct contact with the body fluids of this patient, particularly the oral or the respiratory secretions. Use the disposable gloves while handling the patient. Avoid exposure to any potentially contaminated items in his immediate environment, like any of the utensils also. And food must be provided to the patient. One can do like putting like a table outside the room, and the food can be put, and the person can be just knock the door. One can come outside wearing the mask and take the food inside. At times, the disposable utensils can be used, or if disposable is not there, the utensils or the dishes can be washed differently with the soap and detergent, not mixing with the other utensils. Then the clean hands, taking off the gloves and the handling used items, and always wear the mask while you are looking at these patients. Next, please. Next, please. So I haven't talked about any of the drugs. You must be wondering, the doctor sitting here not even telling the drugs. I don't want to go for that, because many of the medications, they are not actually advisable. As I told you, the WhatsApp community has been spreading, and many of them may have certain caution related to it because of certain medical conditions associated in other person. So only and only if a doctor advises you to take certain medication, then only take that. Don't do your treatment sitting at your homes all your own, because in that case you may be deteriorating the condition, which may not have occurred had you been not taken those medications without any advice. So when to seek medical attention? Whenever there is difficulty in breathing, whenever there is dip in the oxygen saturation, which is like less than 94%, whenever there is persistent pain or pressure in the chest, or there is mental confusion or inability to arouse the person. Next, please. Now, the most important thing is not just the physical health, as I mentioned, how to cope with the stress, which is most important. And it's quite normal that we can feel sad sitting in isolation, and not even just the isolation. These days, everybody's sitting at home feeling sad, confused, what to do. This crisis is going on, feeling angry. Try to connect your friends, your family, people who you trust, talk to them. Then stay at home with a healthy lifestyle, have good diet, then social contacts with your loved ones through the emails or the phones. Don't use smoking, alcohol, other drugs to deal with your emotions. It will worsen up the conditions. Don't do that. And if you are feeling like you are overwhelmed, you must talk to a healthcare personnel or a counselor or a doctor who can actually help you out in such cases. But don't do that. And then getting the facts and gathering the right kind of information. As I mentioned, don't use the WhatsApp community. Go for the credible sources for information. Limit your worry and agitation. I'm not the one who is against of any of the TV channels or something, but I must say a lot of media at times is creating negative effects on people. So one can always avoid. One should always know what to use, what to see and what not to see. So that is our opinion. Then draw on your own skills. You can paint, you can listen to music, good things, read the books, whatever you feel like doing the best that you can do that. Yeah, next please. Now, for you guys, it is most important having the safer workplaces. So what you need to do for the safer workplaces? The temperature check should be done at every point for everyone. That has to be ensured using like a thermal gun that can be used. Then the face mask should to be worn by all the staff all the times, and adequate stock should be maintained by the organization all the times. In cases we may say that there are construction workers who are working all the time, and then they won't be wearing the mask because in those cases they are sweating a lot. Yes, that is one problem. But then in those cases where they are working, one must ensure either there is a business continuity planning for that, where there is no crowding of the people together, and if there is, then one must ensure that they are using the mask. And if they're not able to afford one, then you are the people who have to help them out to prevent the infection from spreading. Then adequate hand wash or the alcohol-based sanitizers should be used at all the entry point. They should be present at entry points, exit points, as well as in the meeting rooms and all the common areas. Then supervising personnel should ensure that there is a physical distancing of at least 1 meter at all the times, and adequate gaps between the shifts and the lunch breaks should be there. They should be staggering enough. I know it's good to sit together to have lunch with the friends, but these days we should avoid. And the organization should have a standard operating procedure and the business continuity planning. Like for people who have to work, then there has to be certain staggering in the duties can be done. Timing zones can be staggered. The percentage of the people who are coming, like suppose you're sitting in the lab, so how many people at a time can sit in the lab, like with the social distancing maintained, and only 30% occupancy can be maintained to start with, and then followed by the things go better, then we may increase to 50. So these kinds of business continuity planning have to be made, and also taking care that for every kind of the skill which you are developing, there has to be some standby. Suppose one person falls sick, who will be there to help that? So, we have to take this in mind, because the current scenarios are that we don't know who falls sick to who. Yeah, please, next please. Then there have to be approved signages which should be displayed across the workplace for maintaining physical distances, and as well as for the do's and the don'ts for all the employees. Then the organizations need to define and place the clear instruction for the visitor at entrance. Somebody who is not required at their place should not be allowed to enter. And each and every visitor should be checked for the temperature, should be provided with the face cover and the hand sanitizer, and adequate signages should be there to how can person navigate. But because one can go from one place to another, going on, doesn't know, because these days half of the people are not there in the facility. So adequate signages are required. Only the essential work travel should be allowed. Most of the work which can be done through online platforms, sitting at home, should be encouraged as and when required. And nearby hospitals and the clinics authorized and identified for the workplaces, they should be identified by the organizations, so that in case of any anonymity or any situation where somebody falls sick, one should know where to take this person. Yeah, next please. Then what to do if there is somebody positive who tests in the workplace? If suppose any of the employee who registers like a high temperature, like more than 37.5 degrees Celsius, or displays any of the COVID-19 symptoms, there should be a dedicated area known as the isolation area, which should be known to everyone. In those cases, that person should be isolated. And if the mild to moderate symptoms are there until the test results you have it, you can just ask the person to move to that facility, then to the home. But for that also, the transport facilities should be arranged while ensuring all the physical distancing as required. And the person who is taking this infected person, the driver, should be using the mask all the time and sanitizing. Next, please. Now, if suppose there is somebody who is tested positive in your workplace, how do you disinfect that area also? That is important. In those cases, one should go for the detailed tracing. Now, at times we may say currently it's a community spread has already occurred, where we cannot actually trace who was the first one who got infected, who was the next one. So in those cases, I am sure it becomes difficult. But where you actually have understood that there has been a contact with a particular person of this infected person, then those close contacts should also be put into the quarantine. That is at most required, because those will be the person who will be transmitting the infection to the others. Then refer to this person to the facility, and the whole of the building should be closed for 48 hours and disinfected as per the guidelines. Next, please. So, at last, my only takeaway message is the best and the only available solution is to get vaccinated this time, and using the appropriate COVID-related behaviors if you want to prevent the disease. So vaccination is most important. And yes, there are certain exercises, there are available how one can increase the lung capacity. There are available exercises, and one can do proning these days. It's shown everywhere on the news channel and all that. So one can follow that for somebody who's sick. For usually, it is also said that to blow a balloon, which is easier to increase the lung capacity. So that is the easiest process. Or deep inhaling and exhaling kind of exercises can increase your lung capacity. So one must do that at home or workplace whenever one gets time. Yeah, that's all from my side. Any questions?
Thank you, ma'am. Now, I have a list of questions which
Yeah, sure.
people have asked. So the first question is, regarding the masks, is there any particular reason why we are doing sun dry and not machine dry?
Sun drying, see, sunlight itself acts as a disinfectant for many of the infections. If you have heard from your ancestors and dadis and nannies who have been telling you to put the things in sun dry, machine dry can be used, but then eventually you are putting an infection in the machine with along with other clothes, because the mask only won't be there for for getting disinfected or for cleaning. Other clothes will be there. So don't do that. Don't mix it with other clothes. Just put it for the sun drying. Sun drying, sunlight itself removes the infection and prevents many of the infections, and it acts as a natural disinfectant.
Thank you, ma'am. The next question is, due to some reasons, if 8 weeks have passed for the second dose, and if it is taken in the ninth week, is it a waste? Does
No,
it count as first dose or second dose?
it is not a waste at all. See, in many cases, as we've seen currently, somebody may fall sick, or in these scenarios, because there are lockdown situations, or one may not even have an access to the vaccination, or the vaccines are not there in certain states. We are facing a lot of issues like vaccine logistics are not there. So in those cases, yes, one may delay the vaccination to 1 or 2 weeks. Is never a problem. It should be taken as second dose if taken on 8th week, 9th week. It's not a problem, but one must take the vaccine. That is most important. Yeah.
Thank you, ma'am. The next question is, how about asthma patients? How about asthma patients? How to differentiate if it is asthma or breathlessness due to COVID?
See, in case of asthma, it will present with a wheeze. Somebody who is suffering from the asthma can themselves say that this is a wheeze, where you have those voice coming from your chest. How should I describe you? It's quite quiet, audible. Somebody who is suffering from asthma bronchitis, the wheeze kind of a sound. So that is there. It is a usual thing. But in case the asthma person develops something like the fever, or there is a history that there is someone else in the family who is having a COVID infection, uh, or there is a history of travel outside, in those cases, if the person develops fever, or in any case the person develops fever or diarrhea and other symptoms like running nose, conjunctivitis, then one should think of that it is asthma, because asthma itself does not only won't present with fever as such. I'm not audible, I'm sorry.
Hello? Sorry, yeah. Am I audible now, ma'am?
Yeah. I'm sorry, it wasn't good.
So the next question is, are N95 and cloth masks enough for the fine dust that flies in the construction sites?
Your voice was breaking. Can you just repeat the question, please? Yeah.
Okay. Are N95 and cloth masks enough for the fine dust that flies in the construction sites?
Yes, they are enough. I mean, there's no doubt that for the construction sites, there will be a lot of dust particles which will be settling there. So the N95 itself, if you're just using an N95, that is effective. But if you're particularly using it for something like an aerosol, or such kind of particles where very fine particles are present, then one can think of N99 also, not just the N95. But for this virus, if you're particularly asking, N95 is sufficing.
Thank you, ma'am. I think there's one last question.
Yeah.
So people want to know how is the psychology of doctors during this time, say upcoming doctors like our friends, friends who are going to be doctors soon. Like, how is the psychology during this time?
So the one who
Or the
are gonna
mental
be
state or something?
so who are going to be doctors, the psychology can be best described by them, I must say. But I know there is a lot of hue and cry, and we as medical people are going through a lot mentally, physically. We have been affected that the care have to be taken, that the disease should not be transmitted to the family as well. There are those concerns. But a doctor is somebody who's not made and like the because who won't get away, somebody who loves to work with patients. These things won't affect them. For people like us who have been working with patients for a long time, we feel like, oh, that's our duty. So whether it's night, whether it's day, so once it becomes your duty, you cannot get away. Imagine a soldier. I believe we are now the soldiers. The doctors and the nurses have become the real soldiers on the war footing. So how can a soldier run away in such instances? That is the adrenaline rush which keeps you going despite such situations, despite going through a lot in your families or around relatives, everybody, somebody's getting sick, day, night, it's there. But yes, that keeps going, and that's how the duty keeps you alive also and drives you.
Uh,
Ma'am, we have few more questions.
Mm-hmm. Sure. Has the streaming ended?
No, ma'am, is streaming now also.
Okay. Okay. Please go
Yeah.
ahead.
Like one have asked that at home they don't have enough space or balcony. It is depressing
Mm-hmm.
for them not going outside. What should they do?
I know it can be actually depressing when you have not got a balcony or in such situations. I've already dealt with such cases. I myself had undergone a quarantine for 14 days, sitting a place where there was no window. And I know it's very depressing at times, but the only way is to do exercise. You can just switch on the television or your laptops, phones, which have different exercises available. Stay inside, do certain exercises that actually helps to regulate the blood flow, gives you better, good energy during those times. Eat fresh fruits, avoid junks. Junks make you more lazy, you feel more depressive. I know you feel it's good to eat, it's lovable to eat good empty calories, but at the end of the day, you feel more depressing after having all those things and become lazy. So just do a lot of exercises, and if possible, do pranayam and the yoga. These things actually help.
Oh, thank you, ma'am. Next we have someone asking, I have only dry cough. Should I go for a COVID test?
See, if you have a dry cough, that could be a symptom of COVID, but also depends upon how many days of dry cough it is. Had it been a long dry cough, probably many weeks, then it has to be something else. Think of bronchitis also. But if it is the recent dry cough, then, and along with that, whenever COVID is there, not just the dry cough, the body ache is there. There is feeling of weakness, malaise, things like that. So if you are having all those symptoms, you can get yourself tested.
Okay, ma'am. Thanks a lot. And next question is, should there be any diet changes for infected patients?
Uh, Not exactly, but we would prefer that the person should take a lot of fluids, stay hydrated, as I told. A lot of fluids help to take out the toxin, the viral. There are a lot of viral toxin in the body. So they help to rush out the toxins. Avoid empty calories, junk food, particularly, and take a lot of high protein diet. The high protein diet, which I want to say, like things like paneer, soya bean, so, and usually the wheat roti is also good in proteins. So, yes, so all these things can be taken as a high protein diet.
Okay, ma'am. Thanks a lot. And
Thank you.
brings us to the end. Sohani?
Yeah. So, as a last question, how can we volunteer as students for Doctors Week? How can we volunteer for this cause?
You can volunteer anyways. We need people like you who are tech savvy, who can actually volunteer to help us to maintain the data and all that. We are running so many centers, isolation centers, who can maintain the data sources. You can volunteer during the vaccination campaigns, just spreading the good message, get vaccinated, act as social mobilizers for the community. Because these days, if even if you have the vaccine, there is a lot of vaccine hesitancy. People don't want to get vaccinated, going up onto the numbers. This vaccine is good, this has better efficacy, that is better efficacy. Oh my God, don't go into the numbers. The important thing is get vaccinated. That is most important. Then along with that, also, not just for vaccination centers, you may help people through connecting to us, who are in the dire need of our support, or probably the families as such who need home isolation, or need help for that. So yes.
Thank you, ma'am, for this wonderful session.
Bro,
Yeah.
It was
yeah,
really informative. Thank you so much for sparing your time for us.
yeah.
I'm sure like our doubts
Just
got
touch it
cleared. We are
on thank you
more
slide, right?
prepared to take our internships, to go for workplaces. So thank you very much. Thank you so much for joining us.
Mm-hmm.
Thank you for inviting me. Thank you for giving me this platform. Thanks a lot.
Thank you, ma'am.
Yeah.
Oh, it's ended. It's
Okay.
ended now. Putting the thank you on.
Yeah, thank you, slide on the thing. Thank you, slide. I'm going to stop the window share.